Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36.
We're talking today with Dr. Rachel Tisnado, a highly respected epidemiologist and expert on yellow fever. Dr. Tisnado, firstly, what is yellow fever, and what triggered your deep interest in this disease?
Simply put, yellow fever is a viral disease transmitted most commonly to humans, and also monkeys, by infected mosquitoes in parts of Central and South America, and also Africa. It takes about 3 to 6 days for the illness to begin after the initial mosquito bite. But what's so interesting to me is that up to a week after symptoms appear, an infected person can actually retransmit the infection to the mosquitoes who bite them, forming a seemingly endless cycle. That was the point that grabbed me and pulled me in, so to speak. And then what kept me involved was the fact that my son, who was 22 at the time, then contracted this disease just after my research had begun. The distressing part for me, not only as a doctor but a mother, was that this could have been avoided if only he'd taken the recommended precautions. A simple vaccine.
If the vaccine for yellow fever is available, why are people avoiding it?
It's highly recommended to all travelers who plan to visit particular regions, and the large majority follow this advice. However, individual beliefs and personal choice greatly impact this, which include concerns over serious side effects, which I should point out are rare. In this day and age, information on vaccination is now readily available to all through the internet and social media, which sadly is where a lot of people are gathering their so-called facts, which then lead to their decision-making. With all good information, there's also misinformation, and this is the dangerous part because that misinformation is often included in the formation of people's beliefs. Instead of communicating with medical professionals, which is vital, the factual data is sometimes overlooked, and that's when people run the risk of potential infection.
Now, I know your son fortunately survived. Can you tell us more about his case?
Unfortunately, he was in the group that overlooked the available data and my advice. But he was only a young adult at the time, so I can hardly blame him for this. He was lucky. Yellow fever is characterized by two stages. In the first, symptoms such as headache, fever, and muscle pain are common. About 15 to 25% then progress to the second stage, known as the toxic stage. And if he'd progressed to that level, I may no longer have a son. Of those who do enter the second stage, half die within 10 to 14 days after onset of the illness.
Brazil has often been labeled a high risk for contracting yellow fever. Can you give any statistics?
In 2017, there were 10 travel-related cases of yellow fever from tourists who'd visited Brazil. I should say that none of the 10 reported cases had received a vaccination, and I firmly believe this outweighs all other causes for contracting the disease. Of the 10, half were from Argentina and Chile. The other 5 were from parts of Europe. This suggests to me that going unvaccinated has little to do with mass education, government spending, or the like, although I'm still a big supporter of such methods. I believe it comes back to a combination of individual choice, fear campaigns, and misinformation. But the bottom line is, again, vaccination. And, to a lesser extent, a belief in the "it won't ever happen to me" scenario.
Right. For those who don't have the vaccination, are there other steps to take to prevent contracting yellow fever?
Of course. And doing so saves countless lives. There are a number of prevention methods that all people should take, even those who've had the vaccination. Avoiding mosquitoes is the most obvious of these. Those that transmit yellow fever are actually most active during the day. Wearing repellent containing DEET and light-colored, long-sleeved clothes is a must. Leave the perfumes and colognes at home, as they can attract mosquitoes, as well as using screens to prevent them from entering your accommodation. Even at night, a mosquito net is recommended. These are all good safeguards, and I'm certainly not entirely dismissing them, but to me, they are still a gamble. Vaccination is hands down the superior method, which, by the way, lasts for a lifetime.
So, what needs to be done to get the correct information across?
Education always has and always will be our most valuable tool, but people find the topic and language of vaccination confusing. Of course, more needs to be done to get the message across to all people, and a positive way to achieve this is to make specialist knowledge freely available worldwide in a dedicated website with factual, evidence-based information in a language everyone can understand.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Hi everyone, my name's Jennifer Seaver. I'm a clinical nurse educator and I'm here today to talk about something very familiar to us all. It's a routine that can potentially save numerous lives and one that we've all been taught since we were toddlers: hand hygiene. This is described by many healthcare workers as possibly the single most important tool in preventing the development of healthcare-associated infections between patients. Infections such as Staphylococcus aureus, Clostridium difficile, MRSA, and gram-negative bacteria. Most hospitals have strict policies and guidelines that we must all abide by. So if it's so important, why do we continue to see such an underutilisation of such a basic practice? Why don't we follow the procedures that should already be ingrained? This, unfortunately, has proven difficult to determine. Let's first put things into perspective with new data from the Centers for Disease Control and Prevention in the USA, which found that 1 in 25 patients acquires a healthcare-associated infection during their hospital care. Now, for whatever reason, this figure doesn't tend to set off any real alarm bells in people, but that adds up to about 700,000 infections a year. A little more alarming. The clincher, however, is of those, 75,000 patients die from their infections. That's an incredible number, and one that should shock anyone hearing it, because it's a number that quite often reflects human neglect and forgetfulness. One may even suggest at times laziness. Stopping the spread of infection by way of hand hygiene is hardly a new concept. Its importance was first brought to life in the mid-19th century when it was found that physicians who washed their hands before delivering babies prevented deaths in postpartum women. Such an idea was initially ridiculed, as most new theories are. But even now, after centuries of knowledge, it seems to me we're still, in many ways, ridiculing it by simply overlooking this basic practice. In stopping the spread of infection, even the most advanced healthcare is of little use if the basic principles of hand hygiene are neglected. We have valuable technologies and intricate tools at our disposal to prevent hospital-acquired infections, and yet such advancements can so easily be made redundant if healthcare workers don't toe the line and simply neglect to wash their hands. That doesn't sound like genuine advancement to me. One of the most valuable things about hand hygiene is that it works for so many different types of organisms, and you get a lot of bang for the buck, so to speak. Such great protection from so many nasty things by such a simple and inexpensive action that any person can do with ease. The issue is that you have to practice it at a high level of compliance for it to work. Within a hospital setting, there are so many opportunities for hand hygiene, and it's difficult to get a level of compliance where we're able to make changes to infection rates. What we need to do to combat this is to turn hand washing into what many people already suppose it is, an instinctive ritual. So how do we monitor people in a healthcare setting without hovering and interfering? The gold standard in monitoring hand hygiene compliance is direct observation. But the reliability of this method to measure true, actual compliance is questionable. This is because it increases dramatically when observers, who are usually well known to the staff, are circulating in the unit. The rates then decline almost immediately once they've gone. Furthermore, being a known staff member also influences this. I'll give you an example. In one study, we hired a student for hand hygiene observation in the same unit as a well-known staff member. We found that the staff member observed close to 70% compliance and the student observed close to 30%. The bottom line is that there's a big discrepancy there. The main problem associated with a lack of hand hygiene compliance, I believe, is that humans are not, in fact, naturally hardwired to perform hand hygiene in the absence of sensing a substance on their hands. If compared with the use of seatbelts, for example, most people don't even think about putting the seatbelt on when they get into a car. They do it on a subconscious level, and they're usually not even aware they put it on. That's where we need to be with hand hygiene, hardwired so that we do it without even thinking about it. When a behaviour is hardwired like that, you can always sense when you didn't do it because you start to feel uncomfortable. It's a long process, however, to get to that end point.
That is the end of Part C. You now have 2 minutes to check your answers.